Good morning, everyone, and welcome to the IMU Virtual Postgraduate Information Session. My name is Ching Lee, or some people call me Dr. Lee Ching Lee, and with me here is also Dr. Tan Ling Young, a credentialed diabetes educator with IMU, International Medical University. So this morning, I am very pleased to have this session about diabetes education and the career pathways in Malaysia, and also to introduce a program we have at IMU, which is the Postgraduate Diploma in Diabetes Management and Education. But before we go on, I just would like to remind everyone on some housekeeping rules. Firstly, if you notice, we have muted the microphone for all attendees. And if you do have any questions and feedback, please do share them by using the question and answer panel. We will also have a question and answer session at the end of this whole sharing, so that we can answer your questions, because I understand that career pathways for different people may mean different things. We are also recording this live webinar session, and we'll be uploading the recorded session onto the IMU YouTube site. So if you want to go back and take a look at what we've discussed, do visit the YouTube link, YouTube site. And also if you have friends who are unable to make it today, do share the YouTube link with them, right? So I will just move on now to introduce Dr. Tan. So the next speaker is actually Dr. Tan Ling Young. Now, Dr. Tan Ling Young is a credentialed diabetes educator with a nursing background. I have known Dr. Tan Ling Young for quite some time now, and am very delighted to have her on this platform, because Dr. Tan actually has more than 30 years of experience working in the field of providing diabetes care to people living with diabetes. Now, what does Dr. Tan do? Well, she wears many hats, okay, as a credentialed diabetes educator. Firstly, she is a practitioner. She has her own clinic in Malacca and also in IMU Bukit Jalil. Secondly, she also teaches. She teaches diabetes education and management at IMU. And thirdly, I think, and that this is where I'm most awed by Dr. Tan, she plays a huge leadership role. She's a mentor to many diabetes educators in Malaysia. She has led the diabetes education scene in Malaysia and continues to try and grow it, to upskill everyone, I think, in order to really exact good changes in our patients living with diabetes. So I can go on and on talking about Dr. Tan, but the stage is not mine. So I'll pass this session over to Dr. Tan to just share with us a perspectives on what are the career pathways that are available for people who would like to be diabetes educators. Dr. Tan, over to you, yeah?
Thank you, Dr. Lee, for the very kind introduction, and good morning to all. Being a diabetes educator for over 3 decades, I feel that diabetes education training is a very specialized training. Not only that, it is a niche profession. Broadly, the career pathway for diabetes educator globally, it falls into these 4 categories. The clinical, where the majority of the diabetes educators are, management, industry, and academia. I will elaborate this further in the following slide. Next slide, please. As you can see, this slide, I got it from the American Diabetes Education and Clinical Specialist website. If you look on your right-hand side, where can diabetes educator work? Remember, I mentioned the clinical area. They can work in outpatient, inpatient, wellness center. There are plenty of wellness centers in America, in Malaysia, and globally. Diabetes prevention program. Some endocrinologist clinic, in fact, many, and that I know of, like in Taiwan, in Singapore, and in Malaysia also, they employ diabetes educator. Diabetes educator can also work in primary care setting or group setting. I understand that in Kuala Lumpur or in Klang, there are group setting of GP clinics where they employ diabetes nurse, diabetes educator, or they send their staff for training. diabetes unit manager and research. And many of my friends or my colleagues at international meetings, and they do a lot of research in diabetes education and management. And on the left-hand side, so what can you do in this setting? You can be a certified diabetes educator or a credentialed diabetes educator, depending on the country that you get the status, if you meet the criteria. You can be a quality coordinator for program. There are many centers, many research areas, or many institutions that have diabetes education program for people with diabetes. They have diabetes prevention program. So you can work as a quality coordinator for the program. Clinical project manager, because there are many projects going on. So sometimes employ diabetes educator as a clinical project manager and just a clinical educator. Or sometimes in community setting, they may look for certified peer support specialists who need to have the qualification of a diabetes educator. Database administrator in diabetes or endocrinologist, the one it applies in where the group setting are, where the institution with diabetes program or in research. And some diabetes educator, they actually subspecialize into pump, to be a pump nurse or wound care nurse that require further training as a diabetes educator. Next slide, please. So being a credentialed diabetes educator from Australia, I just Google, if I so choose one day I want to go to Australia, what are my job opportunities? As you can see, there are 182 jobs. If you can see, if you look at the left-hand side, for diabetes educator, on the right-hand side, it just sounds the example that they are advertising. That is only about 10 to 13 days ago. A credentialed diabetes educator that in Melbourne, in Perth, they're all looking for diabetes educator. They're looking for trained diabetes educator. Next slide, please. So in the pharma company, there are so many of them. These are just a few of the pharma company. They are advertising, they are selling diabetes products or diabetes related products. So if, let's say, if you have received training in diabetes qualification, especially post-diabetes qualification, what do you think of your employability? It will definitely be increased on top of whatever profession that you are in, being a nurse, being a pharmacist, or being a dietitian. As compared with another graduate who is applying for the job that is without diabetes training. The reason is you can help your pharma company to promote the product better because you will know the product better. And that applies to retail pharmacy. As you know that Malaysia, we have several chains of retail pharmacies. And who are the people, who are the clients who go to the retail pharmacy? A big number of them are people with diabetes or the caregiver with diabetes. That is where the retail pharmacy eventually will look for diabetes educators. And I know some retail pharmacy are already starting specialized diabetes services for their clients. If you look on the left-hand side, you can see that in Pakistan, they are looking for pharma job for diabetes educator. No one noticed. They are looking for diabetes educator, and there'll be many others to come. Next slide, please. How about job opportunity in Malaysia, you may ask? I also Googled it, and you can see straight away on my Google search, I didn't go to job straight. I just Google for it. Diabetes educator job in Malaysia. This is what I found. In Cranberry, there are several. Even in Penang, a hospital looking for diabetes educator. And this one, lecturer, senior lecturer in diabetes management in Kuala Lumpur. So as you can see, as a diabetes educator, if you undergone a training, especially postgraduate training in diabetes management and education, your job opportunity is always there. And for myself, being a diabetes educator for so many years, we also involved, that's why I work in clinical area as well as in the academia IMU, where I train diabetes educators. And we were, as a diabetes educator, we can also participate in research. The next slide, please. I'm sure a lot of you will be familiar with the National Health Morbidity Survey. This is a national survey that is done by Ministry of Health every 4 years now because of the high prevalence of diabetes in Malaysia. And this slide shows you the latest report from National Health and Morbidity Survey 2009. In Malaysia, 1 in 5 adults above the age of 18 has diabetes. In 2015, the report is 1 in 5. So currently, we estimated there are about 3.9 million people aged above 18 years old have diabetes. So just use my calculation. I calculated we are with the training of diabetes educator in Malaysia, the number of diabetes educators being trained in the Ministry of Health, in some like university like us, there are about 2,000 diabetes educators working in the field now. So if you divide 2,000 diabetes educators to cater for 3.9 million people with diabetes, I come up with the ratio of 1 diabetes educator will have to look after about 2,000 people with diabetes. That is a lot. It means that we do need in Malaysia, with the increasing prevalence of diabetes, we do need a lot of diabetes educators in the near future. You look at the ratio of nurses to patients. It's 1 to 302. We have a lot of nurses. But a lot of nurses, a lot of pharmacists, a lot of dietitians, we can only provide very general advice. Whereas a diabetes educator receives specialized training to help the people with diabetes in their self-management and to improve their quality of life. Next slide, please. So in summary of my talk, it's important. We need a lot more diabetes educators. And as mentioned earlier, we only have about 2,000 in the workforce now. And out of the 2,000, a very quick calculation will tell us, currently there are less than 100 of these diabetes educators at a postgraduate certificate level. Why? Because the postgraduate certificate level has only started in 2019. So majority of them are actually at advanced diploma or diploma level. which will make a difference, which can make a difference in the outcome of diabetes education and management, which Dr. Lee, our program director, will explain to you further on that. So in summary, as a diabetes educator, you can work in either clinical, this is where the majority of the trained diabetes educator are employed. You can also at the management level, where one of our alumni, after her training in IMU with her postgraduate degree, she is currently being promoted to the management level. So she is doing, on top of her clinical work, she is doing training for diabetes educator in the chain, in the group, in the hospital, the group hospital setting that she is being employed. And in the industry, as I have mentioned earlier, there are lots and lots of opportunity. In fact, many years ago, when I met one of the CEO of one of the pharma company in diabetes, he was telling me he hoped that all his medical reps who is promoting the product are trained diabetes educators. And I think the dream can be achieved in academia, because to train diabetes educator, we need a certified diabetes educator, we need a credentialed diabetes educator, we need a senior diabetes educator to train them. So there is always room on that as well. I shall end my presentation here, and Dr. Lee Ching, our program director for the postgraduate diabetes management and education program, will enlighten you on the program that IMU is offering currently. Dr. Lee, over to you, please.
Thank you, Dr. Tan. Thank you, Dr. Tan. I hope our participants have benefited from Dr. Tan's sharing. So as Dr. Tan has described, I'm actually a dietitian by profession and also the program director of this program. Just a moment, when I speak, I can't seem to, there we go, of the program that is known as the Postgraduate Diploma in Diabetes Management and Education. But before I share with you a little bit about what this program is, I would like to share with you my perspective as to why IMU came about with this program. So as Dr. Tan has already shared with you, in Malaysia, our situation is such that one, we have a lot of patients with diabetes. Number two, we know that most of our patients with diabetes have a bit of a problem trying to manage their glucose well, manage diabetes well, because, you know, diabetes is a very complex thing. You get a lot of complications. Patients live with diabetes, their daily living skills that they have to do. Malaysians love to eat. We have a lot of festivities. So the whole management of diabetes becomes quite complex and requires extra skills to help patients to problem solve, to manage it right, okay? So most of our healthcare professionals who function as diabetes educators in Malaysia currently are skilled to the level of advanced diploma. So that's about the highest. There are a few who actually have what we call postgraduate qualification, so beyond the undergraduate qualification. Now, when we manage patients with diabetes, because we have to help problem solve, it becomes complex. We need to do a lot of analyzing. We need to evaluate, analyze, and we need to sometimes even come up with programs, with plans that are very individualized for each patient, right? And to do that, you can only achieve this skill of applying, analyzing, evaluating from either one of two ways. Firstly, you either upskill yourself with a postgraduate level certification, because when something is done at the postgraduate level, the topics that you learn, the skills that you learn, the assignments that you do help to hone such skills so that you can actually help your patients problem solve, or you actually spend 8 to 10 years in the what you call it, diabetes education field, see a lot of patients and learn through experience. So this is the very reason why IMU decided if we want to help the nation manage diabetes, we need to come in with a degree at the postgraduate level. Then the second question we had was, how do we make a program suitable for working healthcare professionals? Because a lot of people, when they decide that they want to move into diabetes education, they may already have just started their career, or they have gone into 1 or 2 years, and they're deciding, this is where I want to go, but I'm a working adult, I don't have the time to, I can't just resign and become a full-time student. So we came up with this program, okay, where it is at the postgraduate level. We put it at the postgraduate diploma level, okay, and it's designed for working healthcare professionals in mind, which means that you can choose to take it at your own pace, okay, as long as it's within the stipulated number of years. Okay, I'll explain a little bit more. So if you do take this program or this course, what will it involve? You will learn a total of 6 modules, and that's delivered on a modular basis over 3 semesters in a year. So our semesters run like this. We have a semester that runs from March to June, another semester that runs from July to October, and another semester that runs from November to February. So we offer 2 modules in that semester, and we have 2 intakes in a year. So we have a March intake and we have a July intake. We're thinking of opening a November intake, but it depends on what suits our potential students, okay? So if you are a student of this program, you can either choose to do it on a full-time basis or part-time basis. On full-time basis means you complete it quickly. So some of our students have decided to do this. They're the type of people who say, okay, I'm going to commit myself to this. I'll pay this lump sum of money and I'll put aside the time. I know for that 1 year I'll be very tight, but I will finish it. So we've had 2 students who have graduated on a full-time basis. And full-time basis means from March to June, you have to complete the 2 modules we show here. In July to October, the next 2 modules, November to February, the next 2 modules, and then you graduate. Okay, we also have the majority of our students are actually taking this program on a part-time basis because they're juggling a lot of other things besides studying. So in part-time basis, they can take these modules in any order, depending on when it's offered, as long as they complete all 6 modules within 2 to 3 years. But you cannot take more than 3 years to complete it. So that's the full-time and part-time mode. And in terms of what you will learn, these modules here, we have designed it so that it's aligned to the skills needed for you to improve the care that you give to your patients with diabetes, plus also giving you the skills to expand your career. So I explained a little bit. We have modules that work on the clinical management. So there's the management of diabetes and its complications, right? And then there's also the care of special groups. So you'll learn about diabetes care in pregnancy, in pediatrics, in the elderly, in special circumstances, in the hospitalized situation. Okay, this is care of diabetes in special groups, right? In the management of diabetes and complications, we will give you a refresher of the pathophysiology in diabetes. We will look at all the different management modalities in diabetes, from pharmacotherapy down to bariatric surgery. We'll look at the management of the macro and microvascular complications, the acute and chronic complications, right? And then we also have a focus on the diabetes education aspect, because we know that in Malaysia, the majority of our patients have type 2 diabetes. And with type 2 diabetes, it is lifestyle management that forms the core, isn't it? But to change your lifestyle, you need to be able to know what to do and to be motivated to do it. So we have this module where we will teach you how to talk to your patients to help them self-manage within the psychosocial context. So there's a lot of psychology at work. And then we also teach you how to provide teaching and how to help your patients learn in diabetes care. So we teach them insulin injections, we teach them carbohydrate counting. How do we do that in a way that really benefits our patients in the local setting? And then we also have the research modules, because the research mindset is very important to help us develop personalized plans for our patients. And in one of these modules, we will also teach you how to do a clinical audit. You learn how to do clinical audit and you actually apply it into your own current setting, so that you constantly look at what you do. Are you achieving your clinical targets? And how do I improve what I do so that it benefits not only my patients, but the organization I work for? So that is the program in a nutshell. right? So how much time do you need to set aside if you would like to take this program? We've done it in a way where we've packed all the learning into two distinct parts. So learning that you can do online on your own. So there's a lot of reading, like guided reading, online quizzes, you have access to the lectures, we may have online discussions or tutorials, but there are certain things that you may need to come back to the IMU Bukit Jalil campus for face-to-face sessions. For example, skills development like talking to patients, or how do you teach patients insulin injection, or how do you work an insulin pump? How do you monitor that, right? So you have to then, if you're a full-time student, so you take 2 modules in a semester, you must make sure within that 4 months, each semester has 4 months, you need to set aside 5 weekdays that you need to take leave from work. If you take this program as a part-time student, so you only take 1 module that semester, so within that 4 months, maybe you set aside 3 days or so of annual leave to come and take this skills development, and the rest is on your own time. Okay, but make sure you set aside time, maybe in the evening, at night, on the weekends, to try and complete the work that is needed. And the good news for a lot of working adults is that we don't have an end of semester exam, because that you would have already done with your undergraduate degree, but here we are working on just upskilling your skills so that it has immediate relevancy to what you do. So all assessment is 100% in course, meaning they're all assignment based, and we try and titrate the assignment back to the type of patients you see so that the learning can be applied immediately. Right? So if you would like to take it, what are the basic entry requirements? Number 1, you need to have a degree, a bachelor's degree in a healthcare discipline. So the healthcare disciplines that we've registered for this program, you must either be a nurse, an assistant medical officer, a dietitian, a pharmacist, a physiotherapist, a clinical psychologist, a podiatrist, or a medical practitioner. And you must show that you have a bachelor's degrees in this related discipline with a minimum CGPA of 2.5 or equivalent. So if you have done it in, say, Australia or America, there could be a different way of calculating it, okay? Plus registration with your official body if where appropriate. For example, if you're a nurse, you must be registered with the nursing board, and so on and so forth. So this is the minimum entry requirements. And of course, we talk about money. This is the approximate amount of money that you will spend per module. So you pay for the module that you take and register for. So it's you have to set aside maybe 5,000 ringgit per module to take this program. Of course, there are the registration fees and the rest of that. So I think that comes to the end of our session. I thank you very much. And now I think let's see whether there are any questions. We'll go to the question and answer session. Yeah. Let me see whether there are any questions from the participants. Do feel free to type your questions in if you have any questions. Right now, I don't see any questions in the question and answer chat, but I have received some questions on my WhatsApp channel. So maybe Dr. Tan, I will just share this, and then maybe we can answer. Maybe that will be questions that our attendees also have. So there's this question, someone asked, can I be both? Can I be a dietitian and a diabetes educator? Can I be a nurse and a diabetes educator?
Yes, you have your own profession. That's why we put in globally. I would say globally, in most of the country, a diabetes educator does not limit to just nurses, because managing diabetes is so complex. They need to learn to be a pharmacist, they need to learn about their medication, their diet, and so on. So the training of a diabetes educator is train you on everything, but we also need to know our boundary. So to answer the question is yes, you are a dietitian. In fact, we have students, currently we have students who are dietitian and taking this course as well. So after when they finish their training, they will have a degree of postgraduate diabetes management and education degree behind their name. Yes, in America, in Australia, they are so common.
Yeah, in fact, I think in our program, we've also had pharmacists to join, right?
Yes.
So basically the pharmacists that have joined us are from the retail sector. So
Yes.
they find that as pharmacists, what happened was that when they are pharmacists in their retail sector, they get a lot of patients with diabetes coming to them. So you are the one-stop center, you know. It's not like you can say, I'll refer you on to the nurse here, I refer you on to the endocrinologist. They have to settle their patients' problems and manage and help their patients there and then. Then they realize that, hey, as a pharmacist, I know my area well, but I may not know the other aspects of diabetes self-care. You know, there's 7, right? Isn't it seven self-management aspects of diabetes, right? From diet, exercise, I think medication taking, complications prevention, problem solving,
Self-monitoring is very important.
self-monitoring, right? So then that made the pharmacists decide to take this program as well, because they want to upskill. So they are pharmacists and a diabetes educator. We also have dietitians, we have nurses definitely, who all decided to do this because of that. And I think when we did this program, we looked at all the other diabetes education programs worldwide. Most conventionally were open either to, I mean, in Malaysia, they only open to nurses or they open to doctors. And we felt that, you know, that may not be a good strategy to help address the diabetes problem in Malaysia, because there are many what we call frontliners for diabetes. Everybody, me as a dietitian, Dr. Tan as a nurse, my pharmacist friends, my doctor friends, you know, my podiatrist friends, they will see patients with diabetes. So if they have this additional diabetes educator qualification, they can already help the patient go further there and then as a one-stop center, sort of lah. That was our.
To add on to your what you have just said, I think diabetes management is a team management.
Team, huh? Yes.
Yes. So we require everybody in the team to have upskilled their knowledge and skill in the management of diabetes. Yeah. That will be the recipe for improve the quality, the clinical outcome, and the quality of life for the people with diabetes.
Yeah, that's right. So the patient is at the center of the care, but there needs to be this multidisciplinary connection. We need to understand how each other works, right? And we complement each other. That's why in the program, we do have that. So let's just say if you have problem-based learning, you have a case discussion, we will include multidisciplinary opinions and options where you discuss the case. So it's not about managing your patient in silo, but as a team. Okay, there's actually, I have 2 more questions actually in my WhatsApp channel. The other one is also, I think, also something that Dr. Tan can answer. So if I take this program, right, do I become a credentialed diabetes educator like you?
Yeah, I'm asked about this question many times. Credentialing is country specific. So currently in Malaysia, we do not have a credentialing body, but the Malaysian Diabetes Educator Society has already started work on this. So hopefully we'll come out with a credentialing body in the near future. Having said that, one of the most important criteria to be a credentialed or a certified diabetes educator is, number 1, you must have completed a postgraduate degree, because that is where the analyzing, the evaluation, how to help the patient to apply the things, the knowledge that they have into their daily life. And number 2, globally, majority of the countries, when you want to be a credentialed diabetes educator or a certified diabetes educator, you need to have 1,000 hours of clinical practice related to diabetes management or education. These are the 2 main criteria if you look at America, if you look at Australia, or even Singapore. And there are others minor criteria, such as in Australia, you need to have a mentor-mentee training program for minimum of 6 months, but that is not required by America. So to have a postgraduate training or to have a structured training plus your clinical hours then you can apply to be a credentialed or a certified diabetes educator.
So meaning, Dr. Tan, let's just say if I'm somebody who's thinking, so for example, if I'm a dietitian and I want to become a credentialed diabetes educator, my first step would be to first take a qualification, a postgraduate qualification in this area. Then I can already call myself a diabetes educator, but I'm not credentialed or certified yet, correct?
Yes.
Correct? Then after that, I have to then apply for the credentialing or the certification with the relevant bodies or organization, depending on the country I'm working in. And that would also require me to submit a portfolio of my clinical hours and my patients.
Yes, and that clinical hours is usually about within the last 3 to 5 years, you collect the 1,000 hours.
Yeah. That makes sense, because then to be credentialed, you know that you have the necessary qualification and the necessary, of course, practice hours as well, ultimately for patients' good. Okay. That's a bit it. Actually, the third question would have been answered already by credentialing. The third question was, when can I already call myself a diabetes educator with this program? So you can, but you're not a credentialed diabetes educator until you apply with the relevant bodies, right? But because this program is done in such a way where it caters to working healthcare professionals, in our students, and it is feedback from our students, right? They found that as soon as they've learned something new, a skill, right, they can already immediately apply it on the patients that they see, and their referring physicians actually do see the change in the quality, and then they see an increase in the number of referrals that they get, because it already improves their care that they give even before you graduate. So I suppose that is what adult learning is all about, isn't it, Dr. Tan?
Yes.
Yeah?
And to elaborate further, a diabetes educator and a credentialed diabetes educator, they are slightly different in their competency. This is where the Australia, the America, the IDF, they have different level of competencies for diabetes educator. Being a credentialed or certified diabetes educator, you are actually at the specialist competency level. So when you just finish a program, when you can, of course, you're a diabetes educator, but you need to collect the hours. It is the years of experience, because every patient is so different. Every patient is so unique. So how you manage them, how you provide the education, there is over the years, 3 to 5 years, where you collect the 1,000 hours, then of course, you'll be better equipped for your future career as a diabetes educator. Then you can apply. By then, I think the Malaysia accreditation program should be ready.
Yes, yes, we hope so. Okay, I think that about wraps up the session for today, because I see that there's no further question and answers coming in on my WhatsApp or on the Q&A box. So with that, I thank everyone for their time, and I hope you have benefited, and I hope now you have a clearer idea on the career pathway for diabetes education. And we will upload this recording as well onto YouTube, so do share that, to check out the IMU YouTube site for the recording. Okay, all right, bye-bye everyone, and have a good weekend.
Bye. Thank you for attending.
Yes, thank you for attending.